Welcome to Nursing School Explained, and this video on the oxygen delivery system, the nasal cannula. So this is a delivery system that we use a lot, and whenever we think about oxygen delivery, we have to keep in mind that room air without any additional oxygen contains about 21% oxygen. So when the patient requires more than that, the nasal cannula is a very good method of delivering that oxygen. And it's a comfortable device because it just rests on the patient's ears and the prongs sit in the nose, and there's nothing that obstructs the patient's mouth, which is why the patient is able to talk and eat, so it is more comfortable for them. And when we hook the oxygen up to the wall or to the oxygen tank, the nasal cannula can be anywhere from 1 to 6 liters per minute of oxygen administration. And each liter that we increase the oxygen delivery, the percentage of oxygen that the patient gets goes up by approximately 3 or 4%. So if we look at this here, if we set the patient up at 1 liter per nasal cannula, they get 24% of oxygen. 2 liters, 28%, 3 liters, 32%, 4 liters, 36%, 5 liters, 40%, and 6 liters, 44%. Now, if we max out at the 6 liters and the patient's oxygen saturation does not respond to whatever the desired parameters are, then we need to think about a different oxygen delivery system, maybe a non-rebreather mask, a Venturi mask, a BiPAP, whatever it is that the patient's situation and condition require. Now, for the nasal cannula for nursing care, remember to get an order because oxygen is considered a medication. And check up the setup and the fit. I don't know how many times I've seen the nasal cannula where only the one prong is in one nostril and it's hanging off to the side of the other one, or it's not fit appropriately around the ears and then secured around the chin. So there are many different things that can happen. And if the 2 nasal prongs are not resting in the patient's nostril somewhat tight and actually blowing that oxygen into the patient's nose, then we cannot guarantee that the patient is getting that percentage of oxygen, because if only one prong is in the nose, they get somewhat of a lower percentage. There's no way of telling how much. So the other thing that's important is to assess the patient's skin, and that includes the nasal passages, so the entrance to the nostrils where the cannula actually sits, and then also the top of the ears, because there's a high risk for skin breakdown if that plastic cannula sits there for a prolonged period of time, just like with any other skin issues when there's prolonged contact with an object. And then whenever we administer oxygen greater than 3 liters per minute, then we want to consider humidifying the oxygen so it doesn't dry out the nasal passages, and then sometimes the patients can have a little bit of dryness, which can lead to crusting, infection, bleeding, those kind of things. So consider that. And the respiratory therapist will be able to help you set that up if needed. So thank you for watching this video on the nasal cannula as an oxygen delivery system. Also check out the demo where I actually show you what the nasal cannula looks like and how to put it appropriately on a patient so that they get exactly the percentage of oxygen that has been prescribed to them. Thanks for watching and see you soon.